So once we come into my office, I will ask them to have a seat, and I will shut the door, and I'll sit here with the person who has diabetes, and then we'll start our appointment this way.
Leanne Carrier is a nurse at the Uville Diabetes Center, working to help educate people about the disease and learn to manage it. The team here also wants to open a screening clinic where people with diabetes could have their feet, kidneys, and eyes screened under one roof at no cost. The aim, reducing diabetes-related complications like vision loss, kidney disease, and amputations.
Lots of people with diabetes who are currently experiencing these complications are doing so unnecessarily. If it's detected early and treated early, then you can really stop that progression.
Carrier hopes opening a screening clinic like this here in Winnipeg reduces barriers.
I would hope that having, the screening clinic can provide access to a lot more people who haven't been going through the screenings, and then preventing that, unnecessarily reduction in quality of life and improving their quality of life, making them feel better and healthier, and then just overall reducing the impact on the healthcare system.
Diabetes Canada recommends foot examinations for people with the disease at least once a year and more frequently for at-risk groups. Annual screening for kidneys and eye exams every 1 to 2 years, depending on the complications and diagnosis. Toni Tilston-Jones is the executive director at Uville. She says the clinic would prioritize equity-deserving populations.
My hope is that it reduces the number of folks that we see who are having lower limb amputations or toes amputated or really bad infections in their feet, folks who are losing their vision or, in their whole lives have to completely change, at least for a short period of time, that while they adapt to what's happening.
Tilston-Jones says they've brought the idea to the health minister's office. She hopes it's a step toward more conversations about the clinic. A statement from Minister Azaguara says, in part, the WRHA works directly with stakeholders on analyzing prospective projects. Alana Cole, CBC News, Winnipeg.
It was about rebound hypos and the sawtooth. So if you see